I appreciate you all coming out tonight. I think most of our brethren and sisterin would say, I don't want to go hear people talk about assisted suicide. So I really have to tip my hat to you. This is a tough topic. It's one that's got a lot of emotion, especially for those of us who've had loved ones that have died and maybe not died well, maybe not had the best care at the end of life, loved ones that have been afraid. That all gets to the kind of core of who we are. So when we talk about this issue, I think it's important for us to do a couple things tonight. As Christians, as followers of Christ, I think it's pretty clear life is sacred, and we all adhere to that, I'm assuming being here tonight. But we need to also get down to the facts, because when people talk about this issue, sometimes it gets distorted. The media, God bless them, sometimes don't get it right, either intentionally or unintentionally. Our side, our voice has to really fight twice as hard and speak twice as loud sometimes to be heard. So by you being here tonight, I hope you can think of it as a bit of an investment. And we're going to have a Q&A at the end. I'm going to talk a little bit, and then Mike, and then Carrie Ann, because we do want to answer questions. We don't want anyone to leave tonight with misconceptions, if we can help kind of get to the core of this. And I'm going to start out by just saying, as a disclaimer, people who disagree with me on this issue can have very good intentions. I think they may be misguided and misinformed, but I don't question their motives. I don't question their life experiences or their reasons for coming to the conclusion to support this. I can have a conversation with them without that becoming part of it. But I want you all to leave here tonight better equipped to have these conversations with your friends and your coworkers, maybe your church members. So I'm going to bring up a couple questions and answer what I think are some of the common questions that come up. First of all, what are we talking about? I'm going to say what we're not talking about. We are not talking about refusing treatment. We are not talking about saying, no, I don't want any more treatment. I want natural death to take its course. That is not what we're talking about. Mentally competent adults in the United States can already say that at any time. You can say, I don't want this treatment to continue. Your legal surrogate through an advance directive can say they would not want this treatment to continue. We're not talking about keeping people alive. If anything in this healthcare system, the onus falls to under-treatment, not over-treatment. Are you getting over-treatment from your insurance company? I don't think so. We get our premiums, our bills paid sometimes. So keep that in mind. We are not talking about refusing treatment. We're not talking about getting adequate pain relief. We are not talking about a double effect. We are not talking about so many of those issues that may get life support. That can all get confused with this. Also, it's important to know that technically suicide's not illegal, right? It's not a prosecutable crime. It is not something that we want people to do. It is bad for them, for their family, their community, but nobody's stopping them, right? The state of Colorado spends millions of dollars in suicide prevention each year. There's a commission set up for that the legislature did. This sends a really mixed message to people. Some lives are valuable, but some lives the state will sanction your suicide. So what are we talking about? Physician-assisted suicide, doctor-prescribed death. There are so many ways you can say it, but it really comes down to allowing a physician to write a prescription to a person who qualifies under a particular act to take their own life, usually by an overdose of barbiturates. So that is physician-assisted suicide. Jeff mentioned euthanasia. That is sometimes they're mixed together, but they are different. Euthanasia is when the doctor does it to you, or a third party does it to you, usually by lethal injection. And that's an important distinction because so far in the United States, the initiatives that we've seen have been by pills. Doctor gives me the pills, I go home and take them. But euthanasia is coming in. It's creeping in through that ballot initiative and some other things. Now, euthanasia can be voluntary. I'm asking for it. I'm volunteering. It can be, I didn't ask for it and you did it to me anyway, or it could be, I can't say anything and you did it to me anyway. So there are different ways that euthanasia can be practiced, and that's going to mean something to you a little bit later when I talk about Europe and what's happening there. So why are the three of us opposed to physician-assisted suicide? Let me give you just a couple ideas here. There are vulnerable patients, whether it is folks in the disability community or elderly or when you're sick. and you don't have people to defend you and be an advocate for you, those are folks that are going to be especially at risk with this. It may not touch you today. You might be able to just live through this and die a natural death and nothing happens, but there are a lot of folks that will be vulnerable to this. So it's an opportunity for abuse. And again, in public policy, we don't look for the silver lining. We look for the areas that people could be hurt. We are like the Good Samaritan. Wouldn't it have been nice if they could have passed a law that the man didn't get beat up in the first place? That's what we're trying to do, not just to put a Band-Aid on it. So you could have an impatient heir who's waiting for an inheritance. You could have a caregiver that is very tired. Caregiving can be exhausting. And this is legal. And they can get their loved one to sign up for it. They can even go to the Walgreens and pick it up for them. They can bring it home and give it to them. And nobody would know whether it was voluntary or not. And those of us who've taken care of older folks or people who are vulnerable after surgeries, I've done that in my family. They're sure dependent on me to give them the right pills when the doctor sends you home with a bag full, right? It can get very tempting, I think, for folks to not do the right thing. And that's where public policy comes in. Carrie Ann's going to talk about the profit-driven healthcare system, and Jeff alluded to that, but just think about it. If a bottle of pills is $300, but good end-of-life care looks limitless in cost, that can be very tempting. So even though they talk about assisted suicide being a choice for the patient, what kind of choice is it when life is expensive, but suicide's free? Doesn't that kind of set up a little bit of tension there for that patient? So who's pushing this? Who are the proponents of this? There's a group in Denver, here in Denver, I say here in Denver, but I'm from Colorado Springs, so I say up in Denver, called Compassion and Choices. Don't you want to sign up for that? I mean, somebody paid really good money for that brand, right? For that name to come up. It's kind of like Coca-Cola, Compassion and Choices. How could you be opposed to that? Well, it came out of a group called the Hemlock Society. Now, that's a very different picture, is the Hemlock Society. Does anybody remember Derek Humphrey, who wrote a book called Final Exit? Anybody heard of that? It was a book that you could check out from the library, and it would teach you how to take a plastic bag and put it over your head and kill yourself. And there were people getting that access to that information who were not terminally ill, who didn't qualify for any of these bills, who were taking Derek Humphrey's book and killing themselves. So that's the roots of Compassion and Choices. When you hear about this issue, and it's going to be really slick sometimes, remember the roots of it are people who come out of the Hemlock Society organization. Now here in Denver, they have about 75 staff people on staff at Compassion and Choices, and in 2014-15, their annual revenue was $16 to $19 million. This is not a small organization. It is mostly donations. There may be some foundation money, but this is nothing to kind of us to yawn about in Colorado as far as the ballot initiatives that may come. Are opponents trying to change the language to make this more palatable? Yes, absolutely they are. You're going to hear phrases like aid in dying, choice in dying. You're not going to hear the word suicide. You're not going to hear anything negative about this in the press and from them because they are trying to make it more palatable. When you've got initiatives like this that are significant changes in the culture, and you see proponents of it trying to change the language, it makes me suspicious of what the real agenda might be and whether that is being exposed and being brought out. They don't like the term suicide, but if someone dies of unnatural causes, think about this for a minute. It's either homicide or suicide if it's not natural. So under these laws, it's going to be one or the other, and we need to call that what it is. What is the status of this in the United States? Well, right now there are 4 states where it's legal. Oregon and Washington, which were both passed by ballot initiatives, and then Vermont and California, which were passed by the state legislature. There have been a truckload of bills in the last 20 years to try and legalize this. Only 2 states have done it by state legislature, and that's been in recent history. This has not been well received by most state legislatures. In the state of Montana, they have a court ruling that says it might be legal as an affirmative defense, but I don't really count that as being legal. So what's happening here in Colorado? As Jeff alluded to, we've got 2 ballot issues that are in the pike, not one, we have 2.
Well, three.
Three. Well,
Sort of.
technically there is three, but one's kind of an offshoot. So we basically have two, and I know that Mike and Carol and Carrie Ann are going to talk more about those because they're the attorneys. You have one that is filed by Compassion and Choices. It is basically the bill that was killed in Denver. That they've put into statute form. And I got to tell you, 2 years ago, when I heard the first bill was coming, I've worked at Focus for 25 years now in public policy. We haven't had anything like this for the last 10 years or so. So we were really gearing up to try to respond. And the bill was killed in like 10 days, wasn't it, Carrie Ann? It was remarkable. And then this year it was killed as well. So I think they're getting tired of the legislature. They want to kind of roll the dice with the public on this. And living in a state that legalized marijuana, I have no idea what this outcome is going to be. It's going to be the Wild West. So the one initiative, 124, for you policy wonks who are looking this up on your phone and wherever, that is the Compassion and Choices Initiative. It basically legalizes this, but you know what's interesting is they talk about, well, look at Oregon. It's going so well in Oregon. Well, the truth is we don't know what's happening in Oregon. It's shroud in secrecy. Oregon has a very minute report, a skeleton of data that comes out once a year. Catch this. The Colorado initiative doesn't require any reporting whatsoever. None. There would not even be a report. We would not know what was going on. It allows a third person to coerce a patient to take the drugs. It allows deadly drugs to be given to a patient that can't communicate. It's got more holes in it than a piece of Swiss cheese. It's just very dangerous. Then you have Initiative 100, which is the euthanasia one that Jeff alluded to. That's being run by a man who really wants to have euthanasia available for anyone. Carrie and I were talking a minute ago. She said it could be a 19-year-old who didn't get his date to the prom. I mean, it is that open-ended. So those are the types of initiatives we're watching. Mike Norton has done tremendous legal work through the years through ADF and other organizations to try to stop these initiatives. Carrie Ann is working on those this time. She is filing motions with the Secretary of State's office to rehear these. She's trying to slow this down. It's a locomotive coming, so pray for her and encourage her. We're going to try and tie this up in court. It could be they can't start they haven't collected any signatures yet, so it could be early May, mid-May, and that could be leaving them 8 to 10 weeks to collect 124,000 signatures. As Carrie Ann said, that's possible, but pretty ambitious, wouldn't you say?
It's about 1,600 signatures a day. And
So-
over about 75 days that they'll have in the time it takes to brief this with the Colorado Supreme Court. So it's about 1,600 signatures a day. So that's quite a few, and that's for each bill. So
Yeah, so
Quite a lot.
there's quite a lot they can do, but we're not sitting on our laurels to wait and see if that happens. We're moving forward with that.